Today I'm going to talk to you about chronic disease and medication management. My name is Mindy Diller and I'm a local dietitian here in the West Texas area. And so first we're going to start off with our learning objectives. So after reviewing this program, participants should be able to identify what are chronic diseases, how these diseases can better be managed, and the importance of exercise, nutrition, and medication. So chronic diseases. What are the diseases that are considered chronic diseases? These are heart disease, diabetes, and cancer. And this is just to name the big ones. There are several others included, but we're going to focus on these three today. These are the leading cause of death and disability in the United States today, according to statistics from the Centers for Disease Control. So that's 7 out of 10 deaths among Americans each year are from one of these three chronic diseases. Heart disease and cancer, and then stroke also account for 50% of all deaths each year. Just for example, in 2005, we had 133 million Americans. Almost 1 out of every 2 adults had at least one of these chronic illnesses. So you can see what a big issue it is, and this number is rising. So major contributors of chronic disease are 1, the lack of exercise, smoking, poor diet, low intake of fruits and vegetables, as well as excessive alcohol. So let's start with heart disease, also known as cardiovascular disease. This is the #1 killer of Americans in the U.S. There are many different kinds of heart disease. Just so you know, we're going to talk about a few of those today, but you may hear multiple terms. We're going to start with maybe one major type of heart disease called, again, cardiovascular disease or just heart disease. You can use those terms interchangeably sometimes. So one major type of heart disease is caused by the reduced flow to the heart. The reduced flow of blood getting to the heart muscle. So arteries which pump blood to the heart can become damaged. They can also get narrower over a lifespan, which causes heart complications. So I'm going to talk about those just a little bit. While cardiovascular disease can refer to many different types of heart or blood vessel disorders, the term is often used to mean damage to the heart or vessels. This is also a funny word known as arterial sclerosis, which is a buildup of fat, some people call it plaque, in your arteries. So once that plaque starts to build up in that vessel, then it makes it harder and harder for that blood to flow through there smoothly, and it restricts flow to the heart. So we'll go back over that here in a moment. But here, heart disease, risk factors. So what are the major risk factors here? A high-fat diet, high amounts of certain foods, such as high fat and high cholesterol. These can build up in the bloodstream. High blood pressure, and we'll talk about these some more in depth. High amounts of sugar in the blood due to diabetes, and then blood vessel inflammation or plaque buildup. So what causes heart disease? Again, it's that high blood pressure or maybe diabetes, because diabetes and heart disease are very related. Sometimes whenever you have heart disease, then you're very likely to become a diabetic as well, and vice versa. High cholesterol, family history, smoking, excessive alcohol and caffeine intake, excessive use of maybe over-the-counter medications like painkillers or digestive aids, and even some herbs and dietary supplements can cause problems. Obesity, poor diet, and inactivity. So how to fight back heart disease? Control your blood pressure. We're going to talk about how to do that. And then cholesterol, that fatty substance that comes from animal products. So too much of a bad cholesterol can build up in the arteries. but it's hard to know which ones are good and bad cholesterol or good and bad fats, so we'll talk about that also. That fat buildup in the arteries causes, again, the slowing of blood and even oxygen to the heart. This increases our risk for a heart attack. So these are the things that we're going to attempt to do to reduce our heart disease risk. So what is high blood pressure? High blood pressure is a serious condition that can lead to coronary heart disease, heart failure, stroke, kidney failure, and other health problems. Blood pressure is the amount of pressure when blood passes through the artery walls. If high for too long, the heart can be damaged, and so can other parts of the body. So high blood pressure. We don't always know what that means. We know that people check our blood pressure and they give us a number, but what do those numbers actually do? So high blood pressure does not always have symptoms, so you have to know your numbers. So the top number, you can see the 120 over 78. Do you think that's a good blood pressure? We'll talk about that in a moment. But first of all, let's talk about the top number. Your top number is the systolic number. That top number, which is also the higher of the two numbers, measures the pressure in the arteries when the heart beats. When the heart muscle contracts, then that is our systolic. Now the diastolic, I remember just because D means down. So just try to find a word association that helps you remember the two. So the diastolic, the down number, or the bottom number, which we're talking about the 78 here. The bottom number, which is also the lower of the two numbers, measures the pressure of the arteries between the heart beats. When the heart muscle is resting between beats and it begins to fill back up with blood. So again, 120 over 78, is it a good blood pressure? So here's a chart that I created for you today just to find out what's normal and what's not. All right, so you can see under the blood pressure category, we have normal, pre-hypertension, blood pressure and hypertension for high blood pressure, stage 1, and then high blood pressure, stage 2. We have hypertensive crisis. All right, so our goal is to keep our systolic, our top number, under 120, and our diastolic, our down number, or our bottom number, less than 80. Is our 120 over 78 normal? It does fall in that 120 and less than 80. So that would be a normal blood pressure. And often you can have it somewhat lower than this as well. So first, knowing your numbers. Total cholesterol. Your total cholesterol needs to be less than 200. But with all the numbers that are associated with cholesterol, it's kind of hard to know what all goes together in that. So you have two types of cholesterol that we're going to focus on today. There are others that maybe aren't as critical for you to worry about, but right now you can focus on your LDL and your HDL. So LDL is low density lipoprotein, and that's a mouthful, so we're just going to call it our lousy or our bad cholesterol. That number really needs to be between 100 and 129 optimally. The main source of cholesterol buildup and blockage in the arteries is when this LDL goes beyond 130. Now your HDL, or your high density lipoprotein, that's the good cholesterol. So your HDL cholesterol is a really good cholesterol, and that's going to help fight the bad cholesterol. So we want that number to be more than 40. So these are the two numbers that you want to remember. Your bad cholesterol, you want to keep it under 130, and your good cholesterol, you want to keep it over 40. Those two numbers combined should never go above 200. So lowering that bad cholesterol. So what can you do nutritionally to make a difference? So one, you can start by eating lower saturated fat. That's less than 200 milligrams per day. So we've seen that 200 number. We know our total cholesterol needs to be under 200. So maybe you can remember total cholesterol less than 200, and you want to eat less than 200 milligrams of saturated fat per day. Cholesterol comes from animal products, so reducing your high-fat meat and dairy intake would be really helpful to lower your cholesterol. High-fiber foods. Why would I want to eat high fiber? Well, if you aim for 25 to 30 grams per day, fiber helps to bind to fat and pull it out of the body. So that's why we encourage you to eat fruits, vegetables, beans, and whole grains, and pastas as well. And then weight management. Being overweight can increase your LDL, your lousy cholesterol, and increase your risk of diabetes. Exercise can lower your lousy cholesterol, and it can also increase your happy or healthy cholesterol. And remember that healthy or happy cholesterol can help fight the lousy. And medication. You can talk to your doctor about these options. Remember, there are some folks that have a genetic issue with high cholesterol levels, and maybe something like this would be appropriate for them. So overall, heart health. We want to increase our fruits and vegetables, an abundant in phytochemicals, and again, we've talked about this before, that those are fruits and vegetables have vitamins and minerals that help us fight diseases in our body. Phytochemicals and antioxidants are both part of those minerals and vitamins that will help. And fiber protects us against cardiovascular disease. And you'll see a trend throughout today that these fruits and vegetables are kind of our superfoods to help us reduce our risk of chronic diseases. I encourage you to set a goal for exercise each week. Your risk of a heart disease increases if you exercise less than 3 times a week. So 3 times a week is a great place to get started, but we want to increase to most days. Another big one is to stop smoking or avoid being around secondhand smoke. This can increase your risk of heart disease as well. Reduce your fat intake and limit alcohol. So how about medications? Well, there may be options for you. Always consult your doctor. Sometimes we forget to fill our prescriptions, and this could be a big issue when we're trying to manage our blood pressure or cholesterol. So keep your prescriptions filled, and certainly take your medications as directed. Those recommendations on those bottles are to protect you and keep you safe. Always check the dosage. So consult your pharmacist if you have questions. That's what they're there for. Another thing is that we tend to forget our medication sometimes. Set an alarm as a reminder, or place your medication in a place that you do something consistently every day. If the first thing in the morning after you wake up and you go have a glass of milk, then put your medication close to the refrigerator so you'll remember. Put it in a place where you do something every day and you see it. Don't forget to keep your medication out of the reach of children and store it in a temperature-safe place. And diabetes. So we've gotten through heart disease and we got through cholesterol and high blood pressure. So now we're going to move on to diabetes. Diabetes mellitus, or simply known as diabetes, or some people may even call it DM, is a group of diseases characterized by high blood glucose levels that result from defects in the body's ability to produce and use insulin. That can all be very confusing, and I'm going to simplify it for you next. But that insulin that you just heard me say, it's kind of a funny word, and what is it? It's a hormone. It's produced by the pancreas, one of our organs, and it helps us regulate carbohydrates and fat metabolism. Again, that can all be confusing, so let's simplify it a little bit, okay? Basically, when we have diabetes, we can't turn our carbohydrates or our fruits, our sugars, all those things into the energy that we need. So insulin in our body helps us with that. Now, diabetes continues to be the leading cause of kidney failure, lower extremity amputations, and blindness among adults aged 20 to 74. So there's 3 kinds of diabetes, and we're going to focus on just one today, but I just wanted to give you a quick rundown about type 1, type 2, and gestational diabetes. So usually, type 1 is diagnosed in children and even young adults, and was previously, many years ago, known as juvenile diabetes. That we've come away from that a little bit, but the body does not make insulin at all when you're type 1. The immune system has attacked and destroyed the cells where insulin is made from our pancreas. Type 2 is the most common that we usually see, and that's either the body does not produce enough insulin or the cells ignore the insulin. And then lastly, we have gestational diabetes. During pregnancy is usually the only time you will see this gestational diabetes. Women that have gestational diabetes during pregnancy are 50% more likely to have diabetes later in life. So diabetes, why do we even need insulin? Well, I told you just a little bit, but insulin turns sugar, or what's also known as glucose in our bodies, into energy for our cells. Without it, our organs cannot function properly. So what causes diabetes? Genetics and family history. Remember, those are things that we cannot change. Ethnicity, and we'll talk about that a little bit more. Obesity, and especially abdominal obesity, which restricts the function of insulin and our energy from carbs and fats to be turned into energy, and for that insulin to pick that up. And then certainly age. As we age, we tend to make less insulin, or maybe it doesn't work as well as it used to. So you can see that there's some things on this list that you can change and things that you can't. So type 2 diabetes. Again, this is the most common type in the U.S. Type 2 diabetes is more common in African Americans, Latinos, Native Americans, Asian Americans, Native Hawaiians, and other Pacific Islanders, as well as that aged population that we talked about. And unfortunately, diabetes affects 25.8 million people and 8.3% of the U.S. population. So we're not too far off from having 10% of our U.S. population be affected by this disease. So there's currently diagnosed 18.8 million people with diabetes. And then there's a whole nother 7 million that don't even know they have it, that go undiagnosed. So it is a huge issue. So what is blood glucose? Basically, it's blood sugar. Now, what happens is when we consume carbohydrates, candy, Coke, carbs, bread, pasta, crackers, any of those things, they break down and they eventually turn into sugar in our bodies. If we have too much of that, then we have extra blood sugar or extra sugar floating around in our blood. If we don't have enough, then that is termed as hypoglycemia, low blood sugar, a condition when not enough sugar is in the bloodstream. Keep food and glucose tablets or even candy on hand for emergencies. So if you have diabetes and you struggle with low blood sugar, that's going to be blood sugar lower than 70 milligrams per deciliter. And you don't have to remember the milligrams per deciliter. You just have to know what normal, low, and high are. So you can see that normal is from 70 to 100. Low is, of course, below 70, and then high is above 126 to 200. Now, hyperglycemia is high blood sugar, a condition when too much or excess amounts of sugar is in the blood. Hyperglycemia is very, very dangerous. Again, we talked about those really high blood sugars, and it can damage our kidneys, our eyes, our nerves. Well, this is when the body does not have enough insulin to turn sugar into energy. So the rest of that sugar just floats around in our bloodstream. And that's what causes a high blood sugar. When you're testing your blood sugar with a glucometer, or maybe your doctor's testing your blood sugar, they're actually taking a small drop of blood and calculating it with a small machine to find out if you're below 70, from 7100, or above that. And I won't go into depth on all of these blood tests, but I just wanted to give you some terms just to kind of be familiar. How do we know when we have diabetes? So how to determine whether you have diabetes or even pre-diabetes, your doctor would order several types of tests possibly. So doctors can determine whether a patient has a normal metabolism, pre-diabetes, or even diabetes in one of three different ways. They can use an A1C test, an FPG, which is a fasting plasma glucose, and the OGTT. And that's the oral glucose tolerance test. Most of the time, the doctors or nurses, whoever may be ordering the test, may not go into depth about these. I basically just wanted to give you those terms so you can kind of see what maybe they might be talking about. Fasting plasma glucose test, you would go into the facility where you're having this test done, and you would be fasting. You would have not eaten all night and that morning. And you would go in and they would check your blood glucose and do a few procedures to see if your blood glucose comes back to normal. And then that OGTT, that oral glucose tolerance test, that one, they would give you a sugar liquid and then see how long it takes for your body to come back to normal. So those might be some things that you might have to do to determine if you are a diabetic or not. So basically, you want to keep your A1C below 5.7, and that means normal. Now, if you have diabetes, normal may be difficult, but there's a goal here that we want you to try to keep it at 6.5, okay? So I'm going to show you a little chart just to kind of get you familiar with hearing these terms and seeing them. All right, so what is an A1C level? Well, basically, an A1C is something that doctors and medical personnel will use to evaluate how well your blood sugars have been for the last 3 months. It's an estimate or an average over a 3-month span of time. Now, we all have red blood cells in our body, and as we eat sugar and carbohydrates, those are broken down and they're put into our bloodstream. Well, sugar particles can actually attach to a blood cell. And when it does that, it circulates through the body until that cell dies off and we make a new one. Well, that red cell has that sugar floating on it, say, for about 3 months. When you do an A1C test, you can determine basically how much sugar has been attached to that blood cell, and it will give you an A1C number, okay? So an A1C is kind of a way for us to see how well your blood sugar's been doing for the last 3 months, okay? So if you say, hey, my blood sugar's great, I take an A1C, and your blood sugar, your A1C is a 13, then maybe your blood sugars haven't been so good, okay? And this isn't to trick you, this is to help you, okay? So the A1C levels Let's say we take an A1C test today and it's 5. Well, roughly that means that you've had about a 97 average most of the time for the past 3 months. So the A1C is a great tool to see if you're actually able to manage your blood sugars, and if not, what we can do to help you as healthcare professionals. So what are symptoms? Do you know what's happening whenever you have high or low blood sugar? Well, there's symptoms that might help you understand if you're having an issue, or maybe educating your family and friends around you to help them understand what the warning signs, then maybe if your blood sugar is high or low. So frequent urination, excessive thirst, you can't get enough to drink. Unexplained weight loss. I've seen some people with diabetes lose 30 pounds in the last month and a half to 3 months. Extreme hunger. You keep eating and eating and eating, and it's just not enough to fill you up. So all of a sudden you may have some vision changes. Your eyes get blurry and it's hard to focus. How about tingling in the fingertips, numbness in the hands and feet, both? Remember, it's that nerve that may be being damaged from high blood sugar. How about feeling very tired? Well, if the energy isn't getting into the cell, then you're not going to feel very energized. Very dry skin, or sores that are slow to heal. When your blood sugars are out of control, your body can't heal its sores or wounds. And then more infections than usual. These are all really good indications when your blood sugar may be out of control. So type 2 diabetes. There are therapies to help control your diabetes. Healthy eating, physical activity, and blood glucose testing. So how do I manage my diabetes? Well, you want to visit with your doctor or dietitian. You definitely want to keep your appointments. I know it's hard to do sometimes. We all get busy. But your health is worth that. Fill and take your medications regularly. Keep your blood sugar below 160. That's our number one goal for diabetes, is to keep those blood sugars at 160 or below. So that means you're going to have to monitor it. You're going to have to check your blood sugar daily, and if you can't, you need to get with your healthcare professional to find out a way that maybe you can monitor it more often, if possible. Trying to control your blood sugars with diet and nutrition. Carbohydrate and sugar intake, if you can decrease those, that'll help. Exercise some daily. Remember, we want to do 30 minutes most days, but our first goal is at least 3 days a week. And then you want to keep a healthy weight. Diabetes nutrition recommendations. So low saturated fat. Again, this is very similar to our cholesterol suggestions on how to lower our cholesterol and support cardiovascular disease in a healthy way. So very similar to before. So less than 200 milligrams per day of saturated fat, high fats from meats and dairy. You want to limit those and increase that fiber, 25 to 30 grams per day, okay? Count carb intake. You may need to see a dietitian to learn how to count carbs until you manage your blood sugars and your carbohydrate intake. So our last one today is going to be the chronic disease cancer. And I guess you can see our trend now that it's high fruits and high fiber diets that can help you with those other chronic diseases. So my guess is that it might help you with this one too. So cancer is a group of diseases that is caused by cells that can divide and grow, forming malignant tumors and invade nearby body parts. That sounds kind of confusing and scary, so we'll break it down just a little bit. So cancer can invade the cells, organs, bloodstream, and the lymphatic system. The good news is that not all tumors are cancerous. So what are our cancer risks? Age, that thing that we cannot change. Higher rates after 65 are more likely. Tobacco increases our risk. That's smoking. It certainly includes snuff and chewing tobacco. UV exposure, which are sunburns and tanning bulbs. Chemical exposures, maybe from certain work environments, painting and asbestos exposures. Those are chemical exposures that we'll talk about. Viruses and bacteria, hormones, and then family history, that thing that we cannot change, that we inherit from our family members. Alcohol can be a factor, obesity, and poor diet and nutrition. So let's reduce some risks. Some risk factors you can control, like tobacco use. Smokers are more likely than non-smokers to develop cancer of the lung, larynx, voice box, mouth, esophagus, bladder, kidney, throat, stomach, pancreas, and cervix. There's a lot of places that you could increase your risk just from smoking or using some type of tobacco. They also are more likely to develop acute myeloid leukemia, cancer that starts in the blood. So, reducing cancer some more. Protecting yourself and your family from sun exposure. Avoid high midday sun. Use sunscreen and reapply every few hours. Wear protective clothing. But how about viruses and bacteria? This one's a little strange, but it is a risk. So be aware that higher cancer risks are associated with diseases such as HIV, HPV, hepatitis B, hepatitis C, lymphoma, leukemia, and the chemical exposure. People who have certain jobs, such as painters, construction workers, and those in the chemical industry, have an increased risk of cancer. Many studies have shown that exposure to asbestos and benzene and benzodiazepine and cadmium, nickel, or even vinyl chloride in the workplace can cause cancers. Those with family history of cancer, get regular checkups. Colonoscopy and mammograms, when recommended by your doctor or healthcare professional, don't wait. Do it at those age intervals that are encouraged. Reduce alcohol intake. More than 2 drinks each day for many years may increase the chance of developing cancers of the mouth, throat, esophagus, larynx, liver, and breast. The risk increases with the amount of alcohol that a person drinks. For most of these cancers, the risk is higher for a drinker who uses tobacco. So, exercise and cancer risks. The lack of physical activity, which has been another theme of the day today. Being overweight, the risk factors for cancer, such as breast, colon, esophagus, kidney, and uterus. So what's our goal? Much like our heart disease exercise goal and our diabetes exercise goal, this one is the same, 30 minutes most days. We want to work towards 5 times a week. But it doesn't just have to be running or high intensity exercise. You can choose many different kinds of exercise, walking, playing basketball with your family, throwing a frisbee at the park, bike riding, running, swimming, house cleaning, washing the car, mowing the lawn. So cancer risk nutrition recommendations. Studies suggest that people whose diet is high in fat have increased risks of cancer. That's colon, uterus, and prostate. Choose a rainbow of fruits and vegetables. We want you to choose 5 to 9 per day. That sounds like a lot, but you can easily get there at least to 5 a day if you include one at each meal and 1 to 2 snacks. So adding different colors increases your vitamins, minerals, and cancer-fighting antioxidants. Make half your plates fruits and vegetables. This is a great way to get to that 5 to 9. So limit high-fat proteins. Here we go with protein again, and that high-fat dairy. So choose lean meats. That's turkey and chicken without the skin, lean beef, lean cuts of steak, that's like top round, even beans, peas, nuts, fish, and eggs. So eat whole grain foods. Make half your grains whole grains. Whole grain pastas, breads, brown rice, and even whole wheat tortillas. Avoid the fried fatty foods. Go for a grilled chicken salad if you're out and about, or even a wrap. Choose baked items for a healthy quick pick. Choose healthy ways of cooking such as grilling, baking, steaming, poaching, or even broiling. Thank you.
This program is intended for the private use of health.edu subscribers. Any rebroadcast or redistribution without the express written permission of health.edu is prohibited.